Hi, Dr. Barker here at Pete Plastic Surgery Center. We get a question multiple times every day about asking what are the best methods for body contouring? This question is extremely broad. Why do I say that? Because body contouring is not just one procedure. Body contouring is a group of procedures that changes the contour of the body. That can be anywhere from topical creams, energy delivery devices, minimally invasive surgical devices, all the way up to full general anesthesia, skin removal, and tightening procedures. So when we talk about body contouring, in its core and very broken down state, it just means how do we change the contour of an area of a body? If we're talking about the arms, are we talking about just a little removal of fat to help improve the overall contour? Or are we talking about removing of some fat as well as tightening the skin or skin removal? Again, belly, same issues. Are we talking about just removing a little bit of fat, theoretically through liposuction, versus excess damaged skin needing a full abdominoplasty contouring surgery? So when we talk about what are the best modalities for body contouring, it is a very, very specific, individualized answer. Each patient has their own concerns and their own hopes for each individual area of their body when they're coming to see me. So when I talk to patients about body contouring, the first thing we always ask is, are you healthy? How old are you? How much do we weigh? How tall are we? That will give us a sense of, okay, are we at close to goal weight for a certain height, certain age? And then we talk about, do you have any damaging of skin in those areas? Do you have any skin excess in those areas? Do you have any just skin texture issues in those areas? What we'll do is we'll break it down for you to understand, is this something that we need to go to my laser or injection specialist? Or does this need to come to me in terms of body contouring through a surgical approach, or at least minimally invasive approach? So if we talk about just small textural issues with the appearance of the body due to skin, many times we can get a great response from energy delivery devices, whether that is lasers to retexture, all the way up to skin tightening devices like a InMode Morpheus 8 that uses gold-plated microneedles with radio frequency heat to deal with the texture of the skin as well as tightening of the skin. If you have excess fat in an area but very small and you're hoping to tone musculature, we have a M-Sculpt Neo machine that helps tone muscles as well as uses radio frequency heat to treat a small amount of the subcutaneous fat and skin tightening in the area. If you have issues with larger fat deposits in your abdomen, your sides, legs, arms, then we may talk about vasoliposuction for body contouring. This can also be added on with brachioplasties or arm lifts or mini tummy tucks for the anterior abdomen with skin excess below the belly button. These can all be done awake in my office so that you don't have to have general anesthesia. It's a much more comfortable and easier recovery with lower risks. If you're somebody that has significant skin excess due to pregnancy, massive weight loss, with today's day and age, with all the Ozempic, the Mounjaros, the GLP-1s, we are having a lot of skin excess issues. Many of those lower modalities for body contouring will not address the areas of concern and not give you the results you were hoping for. We'll talk about full surgical interventions that include general anesthesia. These can include thigh lifts, lower body lifts, gluteal lifts, tummy tucks, full extended brachioplasties or arm lifts, breast lift. All of these things come into play for body contouring. So again, what are the best modalities for body contouring? It depends on the patient. You should go to a clinic that can provide anywhere from the most minimal invasiveness all the way up to general anesthesia surgical correction for your individual concern to reach your own individual goals. How we do that at my practice is we make sure that we talk to you before the consultation to understand what you're hoping to achieve so that you have a good idea of what you're walking into in terms of the consult itself, also the pricing of any body contouring we will be recommending. Then you will sit down with me or one of my laser and injection specialists to go over customized approaches for you and plans so that we're going to help you reach your individual goals not the goals of someone else. If you have any further questions about body contouring, I'm always here to answer anything that you have to help you stay informed and educated on these issues so that you get to make these decisions comfortably and with the utmost confidence. Please reach out. We're always here to help.